Dr Sandhya Rani, working as Senior Consultant Obstetrics and Gynaecology Department, Aster Women and Children Hospital, Whitefield, Bangalore. So today I am going to discuss about menopause and what women go through when they actually go through menopause. So I'm a certified menopause practitioner, so this is my area of passion. So I thought awareness about these changes is very important for us to go through it comfortably. So as we all know, women have menstrual cycles starting from the age of puberty to a certain age. So when these menstrual cycles come to an end and stop completely, it is called as menopause. So stopping of periods for one complete year, only then we label the woman as menopausal. There are many other terms which are very commonly used called premenopause, perimenopause, postmenopause. So let's understand each of these terms one after the other. So perimenopause is the time which includes premenopause, menopause and up to 1 or 2 years postmenopause also. So premenopause is the stage where the ovaries start functioning less effectively. So from the beginning of premenopause to menopause, it may just take about few months. Sometimes it goes up to few years as well. 4 to 5 years is the usual time frame that we observe. So this is the time frame where women go through a lot of other symptoms or hassles, I would call, and they affect the quality of life. So premature menopause is when a woman goes through menopause before she turns 40. That's too early for the periods to stop, and the women can have a lot of other medical issues. So any woman who does not have periods for a year before she turns 40 has to report to the endocrinologist or gynecologist immediately and take a lot of precautions to safeguard her health. The usual age of menopause in India starts from about 43 years and a maximum of 52 to 53 years. On an average, 47-48 is considered as normal for menopause to occur. So the hormonal changes usually begin after 42-43. So, and it extends for about 4-5 years and we see the stoppage of the periods. So what are the symptoms or issues that women go through? The first and foremost is called hot flashes or night sweats. This is sudden occurrence of increased sweating or suddenly feeling very cold. It would be a very comfortable temperature in the room. The rest everyone is fine, but the woman suddenly starts sweating. These are called hot flashes. They are because of the reduced amount of hormones in the body and disturbed temperature regulation in the body. So the woman would suddenly feel embarrassed, she would want to turn on the AC or the fan and she would get dehydrated very soon. So how to avoid these hot flashes? Usually hydrating yourself well in advance, taking a balanced diet so that these hormonal changes are not so drastic, and regular exercise help us cope up with these hot flashes. The second set of symptoms relate to the less estrogen in the body. Estrogen supports the hair, skin, the vaginal secretions. So all these start getting affected. So dryness of the skin, wrinkling of the skin starts at this age. Applying a good moisturizer, hydrating yourself, taking a lot of vitamins help you delay all these changes. You would also notice that the hair becomes lustreless, very thin, brittle, and hair fall increases. Again, a balanced diet and proper hair care products help us safeguard our hair. Finally, we also see that women complain a lot about itching in their private parts, dryness to the extent that they end up having a lot of burning sensation in the private parts, and which may also affect their sexual activity. So again, balanced diet, regular exercise, hydration, and if needed, using some liquid-based lubricants would help them go through it. And whenever any of these symptoms are very severe, women will be put on certain hormones or hormonal support therapy to avoid all these symptoms. But they have to be done after a proper evaluation of the medical conditions that the women have. The bone density of the women starts coming down after the age of 40, and after menopause it drops drastically. So if your bones are not dense enough, they tend to break easily. This is called osteoporosis. So that's where the bone health has to be taken care of in this age group. So the bone requires calcium, so adequate calcium through diet or through supplements. Healthy bone requires vitamin D. Of late we see lot of vitamin D deficiency, so getting it checked from time to time and taking the appropriate supplements is important. Very importantly, the bones stay strong when we put them to use. So exercise. It should be a combination of your cardio to increase your cardiac capacity and also the flexibility and strength training. Everything has to be balanced out in your workout. This is how we can avoid osteoporosis. And those who have a family history where their parents or aunts had easy fractures post-menopause, they are the ones who need to consult us and need to take the appropriate medication to avoid osteoporosis. So the other health hazards which can happen is estrogen safeguards women from high cholesterols and heart attacks. So the moment the estrogen in the body starts coming down, women are more prone to high cholesterols, diabetes, high blood pressure, which in turn increase the risk of heart attacks, stroke. So we never hear of women having heart attacks before 40 years, but once they touch 50, the risk of a woman having heart attack is almost the same as men. This is because the support from the estrogen is suddenly gone from the body. So eating the right kind of food. The metabolism changes after we turn 40. So for the same amount of food that you were taking in your 30s, you may be gaining a lot of weight at this stage. So modifying the diet in such a way that the carbs are less, the fat content is less, but including lot of vitamins, proteins in the diet along with lot of fiber and exercise. This is the only way. Now what do we expect from women when they go through? The first thing is talk to your family. Tell them that you're going through it. Awareness among the family members that these are all age-related hormonal changes. The woman goes through a lot of emotional changes as well. We see them getting very anxious. They may start having faster heartbeat called palpitations. There could be extreme mood swings, and there are women who go into depression as well. This may affect both their family and professional life. So talking to your family about all these things will help them understand what you're going through, and they would support you for the same. Instead of blaming you for your behavior, they will be there to stand by you and support you, saying that okay, we are with you. And whenever all these symptoms go beyond the normal control, like you're not able to manage with simple precautions, it is better to reach out to the doctor. Gynecologist will assess your health condition. So what do we do when women come with us? First, we try to assess the medical history, any risk factors which are already there. Then we do a set of blood work. So to assess your diabetes status, your cholesterols, your calcium levels. Specifically in health checks, women of this age group have to go through an ultrasound to make sure that the uterus is fine, the ovaries are good, there are no growths in the uterus. A pap smear is a screening test for cancer of the cervix. Cervix is the opening of the uterus. So pap smear is to be done once in 3 to 5 years. And then a bone mineral density test, which tells us if you have already entered into osteoporosis stage or not. So frequent health checks, assessing your risk factors, correcting them, and then following it up with regular tests. Menstrual abnormalities in perimenopausal and menopausal age group are very, very common. So for some women, they are lucky enough that the periods just suddenly disappear without causing any problem at all. Usually we see that the periods get delayed, they get lighter, and eventually the interval between periods increases, and then they go into menopause. But not everyone is so lucky. There may be some women for whom the periods come too often, very heavy, and so much so that their day-to-day work is affected, their hemoglobin drops, and the fatigue sets in. You are expected to consult gynecologists. So we'll get the blood test done, we'll get the ultrasound done, and it's very important to rule out any precancerous, cancerous condition. So depending on the ultrasound, we may suggest an endometrial biopsy. If everything is fine, we put you on hormones and help you cope up with this situation. So to sum it up, Awareness of the menopausal symptoms is important. Educating the family about all these is important so that they become your support system. And then your lifestyle. That is the key to dealing with menopause. So once you turn 40, it is time to correct your lifestyle, modify your diet, and then begin to exercise regularly. So hope this information helps you. Thank you.